So good morning. Yesterday, the Department of Public Health reported 786 new COVID-19 cases out of a little over 61,000 tests. At this point, over 21.5 million tests have been recorded here in the Commonwealth. 525 individuals are in the hospital with COVID, and 143 are in the ICU. In December, we set a goal of vaccinating approximately 4 people in Massachusetts. According to the CDC's data, 3.95 million people have been fully or partially vaccinated in Massachusetts, and there's another 180,000 people who are signed up to get their first dose in the next 7 days. Since about 99% of the people who get their first dose in Massachusetts return for a second dose, that means the 4.1 million people vaccinated goal that we set as our target will be fully vaccinated by the beginning of June. This represents an incredible achievement. The people of Massachusetts are outperforming the rest of the country by leaps and bounds. As a result, hospitalizations are down by 77% since January 1st. New positive cases are down by 82% since January 1st. And the most vulnerable residents of Massachusetts are protected from this terrible virus. But with that said, we know there's still a lot of work left to be done to vaccinate more people in Massachusetts, even as supply is now available. Now that we believe we are going to hit the 4.1 million goal we started with over the course of the next few weeks, it's time to adapt our vaccination effort to make sure we get to some of the harder to reach populations. Let me start just by saying that today there are open appointments for vaccines in every part of the state. This includes mass vaccination sites, retail pharmacies, community health centers, and regional collaboratives. This is obviously a welcome change from a few months ago when demand was exceedingly high and supply was not. If you're someone who's waiting to book your appointment when it's easier to schedule one, this would be a really good time to sign up and get your shot. You can go to vaxfinder.mass.gov to find availability in your area. Our administration set out to first vaccinate our most vulnerable populations, including healthcare workers and seniors, and we've seen great success in reaching those populations. Secretary Sutters will talk more on that in a minute. At this point, we're adjusting our vaccine distribution strategy to be more targeted, and we'll shift vaccines to smaller scale operations that can focus on particular communities or particular populations. And by bringing the vaccine to where people are so that everyone knows they have an easy opportunity to protect themselves and their families, we hope to make this process more convenient, more accessible, and continue to add to the count of those who are already fully vaccinated here in Massachusetts. We'll begin this shift in part by providing 22 regional collaboratives with more doses to run their programs, doubling the state vaccine allocation for our 20 most disproportionately impacted communities, and expanding our mobile vaccination clinics. Over 21,000 doses have been administered through mobile vaccination efforts through a combination of our equity work, our healthcare providers, and our mass vac sites. They've been deployed in Boston, Chelsea, Brockton, Fall River, Springfield, and New Bedford, and will continue to expand. The mobile clinics have been particularly effective in our equity communities and to reach people of color. So far, over 60% of vaccine recipients at these clinics have been people of color. We'll continue to expand these efforts statewide to bring vaccines to senior centers, houses of worship, YMCAs, and other community-based organizations. Every community and every region is different, so our administration will look to providers and municipalities as they establish creative ways to meet their community's needs. There are already some great examples of this. The Metro North Regional Collaborative will start operating 3 new clinics, including one at the Encore Casino in Everett, the Tufts campus in Medford, and at the Cambridge Health Alliance location in Somerville. Boston Medical Center, which has already done a large number of partnerships with community-based organizations, faith-based organizations, and is also operating a variety of pop-up sites at grocery store parking lots and other locations that are heavily traveled. We'll schedule appointments for individuals at the South Bay Shopping Center. Lynn, New Bedford, Worcester, and Fall River are offering more mobile clinics at local churches and temples in different languages. And the City of Brockton is holding several clinics at municipal housing and the Westgate Mall. We know physicians are also one of the most trusted sources to administer the vaccine, and that's why our administration has invested in public messaging campaigns that feature doctors and other hospital and healthcare employees as they share all the reasons why these vaccines are tested, safe, and effective. It's also why we work with our hospital, healthcare organizations, and other medical partners to enable patients to get their shots from a doctor. As part of this new phase, the Command Center is talking to the Mass Medical Society to increase access to vaccines with additional primary care providers by the middle of May. This isn't easy and will require everyone working out the complex storage and scheduling logistics to ensure that all doses are put to good use. And finally, we'll transition or ramp down the state's 7 mass vaccination sites. Our mass vaccination sites have played a critical role in the Commonwealth's vaccination process over a very short period of time. At mass vaccination sites, the Commonwealth has administered 1.2 million doses and fully vaccinated almost 500,000 people since the first site opened at Gillette Stadium on January 18th. These sites still have hundreds of thousands of appointments that are scheduled over the next 3 weeks to do more. The state expects to administer around 250,000 second doses in May and another 180,000 first doses over the next 7 days across all of those sites. But as we continue to disperse vaccines more widely across communities, we plan to gradually close 4 of the 7 mass vaccination sites by the end of June. But right now, appointments are still available at those 7 mass vaccination sites statewide. Folks can still pre-register or look on the vaxfinder.mass.gov site for times that work for them. We can't stress this particular point enough. Everyone over the age of 17 can sign up right now on the website to get an appointment at a location that's near them. Whether you want to go to a CVS or a Walgreens or a state-run site or a community health center, there are openings everywhere across Massachusetts. Please visit mass.gov/COVID vaccine or call 211. There's no more waiting or hassle. You don't have to get up in the middle of the night to schedule an appointment, and you can protect yourself, your family, and get back to normal by getting vaccinated soon, today, tomorrow, this week, next week. We're extremely grateful to the healthcare providers, the vendors, and the municipalities who've worked tirelessly to run smooth operations statewide to get our people vaccinated. All our sites have been built to reflect the needs of our communities and to provide a convenient place for all residents to get vaccinated. Today, we're pleased to look back on the last 5 months of the vaccination process here in Massachusetts and take a great deal of satisfaction that the people of Massachusetts have made Massachusetts a national leader in administration and worked with us to set up 900 sites where people can get vaccinated. That allowed us to hit our goal on a timeline that was consistent with the one we laid out in December. As we transition to this new phase, we're confident we'll be able to find more ways to offer vaccines to everyone who wants one through a smaller and more targeted approach. And we're very grateful to everyone who's been vaccinated or is scheduled to get their doses soon. Vaccines are safe, and they are the best way to protect yourself and your loved ones from COVID. People can get their shots from doctors, pharmacies, and at local clinics. And if you have not yet scheduled your shot, we encourage you to do so. Go to the vaxfinder.mass.gov, sign up today. It's quick and it's easy, and there are a lot of appointments available. There's no question that the last year has been a difficult one for all of us, but the people of Massachusetts, time and time again, have stood up and done the right thing when we needed them to most to get us to the next phase of the process. We are here at this point in time because of the work of so many here in the Commonwealth. But it's critically important for everybody who wants a shot to sign up and get one. We will do all we can to make access to vaccines more readily available as we get down to what I would describe as the last 30% of the population here in the Commonwealth that hasn't signed up yet. And we look forward to getting back to normal and putting the darkness of the pandemic behind us. Thanks. And with that, I will turn it over to the Lieutenant Governor.
Thank you, Governor, and good morning, everyone. As the Governor said, we are moving into a new phase in the Commonwealth's vaccine distribution after hitting our initial goal of vaccinating our over 4 million people by the beginning of June. This is a critical benchmark in our pandemic response as we race to drive down cases and hospitalizations and prevent the spread of COVID so we can start to get back to normal. But we know there is still a lot of work to do to reach even more people, especially in our most disproportionately impacted communities. Today, we are here to discuss how we will begin to shift our vaccine program to more targeted vaccine opportunities and gradually ramp down some of our high throughput sites. This includes providing more appointments at our 22 regional collaboratives, pharmacies, mobile units, and walk-up clinics. With 4.1 million people on track to be fully vaccinated by June, the demand for appointments at all locations, including at MassVac sites, has stabilized. The pre-registration system, which was launched to provide more ease in appointment booking, will remain available. But appointments can also be conveniently booked through the VaxFinder website as well. That means you can go online right now and book a time that works for you at a location that also works for you. There's no waiting. We now have the ability to offer walk-up clinics and more mobile vaccine units that we hope will offer even more convenient access to these shots. Since the pre-registration system was launched, over 1.8 million people registered and have been offered an appointment at least twice. In the coming weeks, the state is anticipating that the CDC may authorize vaccines for children ages 12 through 15, and we will keep pre-registration available for parents who may want to bring kids to a MassVac site. More details to come when the CDC releases more information. As the Governor mentioned, 4 MassVac sites will plan to gradually ramp down their high throughput sites by the end of June. These sites include Gillette Stadium, the Doubletree in Danvers, the Hines, and the Natick Mall. But they will transition their efforts to focus on more targeted ways of vaccinating people at the community level. This includes offering walk-up appointments, and information about walk-up appointments will be available on vaxfinder.mass.gov or through calling 211. As we continue to pivot our vaccination program, mass vaccination sites are extending their vaccines into the community in partnership with local municipalities at trusted community locations. These efforts are already underway in Springfield and in Haverhill, with more anticipated in the coming weeks. Additionally, the 5 FEMA-supported mobile vaccination sites in partnership with the Hines, they have been very successful. CIC Health and Cataldo Ambulance have delivered 12,000 plus vaccinations across Boston, Chelsea, Revere, Fall River, and New Bedford. Mobile vaccination locations have ranged from senior centers to elementary schools to community centers to YMCAs to churches, gyms, local community-based organizations, and everything in between. These efforts have been successful at reaching minorities in our vaccine equity communities. 61% of individuals at FEMA mobile sites have been Black, Indigenous, and people of color. We are grateful for the support from our community partners and local organizations, including our outreach workers at ASG and Healthcare for All, for concentrating on these populations. As we continue, the providers and support networks for our MassVac sites will keep focusing on more creative ways to reach people where they are. The Commonwealth has come a long way in our vaccine program, hitting our goal to vaccinate over 4 million people soon to stop the spread of COVID and to start the return to the new normal of our daily lives. None of this would be possible without the incredible work of our command center, our healthcare providers, community partners, and our municipal leaders who have worked day in and day out to set up vaccine clinics and help spread the word and the work about vaccines. If you've not signed up for a vaccine, please talk to your healthcare provider or visit vaxfinder.mass.gov, vaxfinder.mass.gov to find a convenient appointment near you. Please call 211 or visit the website if you haven't been vaccinated. There are open spots right now near you. If you need more information about just how safe and effective these vaccines are or how they protect you and your family, call 211 or visit vaxfinder.mass.gov. Thank you all for your incredible efforts getting us to this point. We have more work to do, so let's get it done. With that, I'd now like to turn it over to Secretary Sudders.
Governor, Lieutenant Governor, good morning. Dr. Bidinger, thank you so much for being with us today. As the Governor indicated, one of the core principles of our vaccine distribution has been to reduce severe illness and death by vaccinating our most vulnerable populations early on. We have been focused on the effective, efficient, and equitable distribution of vaccines from the start. Among the early prioritized groups were the thousands of individuals who were elderly with comorbid health conditions, residents of long-term care facilities, and residents and staff of congregate care settings who have each experienced greater impact from COVID-19's infections. Not the general population, but our most vulnerable. Our nursing facilities, as we all know, were hit hard early on in the pandemic, and it was critical to protect them with vaccines as soon as possible. Early on, vaccines were brought on site to our 400+ nursing facilities and rest homes, in addition to assisted living residences and continuing care retirement communities. 98% of our residents in nursing homes received first doses, and 100% of our rest home residents received first dose vaccinations through the Federal Pharmacy Partnership Program. That translates into more than 34,000 individuals. Today, 84% of our long-term care residents and 71% of the staff are fully vaccinated. And we continue to prioritize and reach out to provide vaccines to nursing homes and rest homes to support newly admitted residents and for staff. And you see it in our numbers. Over the past 7 days, for example, there were 6 resident nursing home cases, positive cases, and 27 staff cases. The combination of vaccines and ongoing surveillance testing is paying off in keeping our staff and residents safe. We will remain vigilant, of course. Our low-income and affordable public and private senior housing has been a successful model of public and private partnerships and the progress that can be made with these strong collaborations. To date, we have administered over 111,000 doses and fully vaccinated over 58,000 adults who live in low-income and affordable public and private senior housing. To offer a little bit more granularity and perspective, this translates to over 850 senior housing complexes across 230 municipalities, including 213 complexes located in our equity communities. This was an all-hands-on-deck effort that included over 170 providers, ranging from local boards of health, fire departments, pharmacies, healthcare providers, our National Guard, community health centers, emergency medical services, and the like. This incredible progress would not have been possible without the partnership of our state's housing agencies, Mass Housing, the Department of Housing and Community Development, and CDAC. And in congregate care, every one of our 400 providers, plus our state-operated programs operating more than 3,500 congregate care sites, that translates to 94,000 individuals, created vaccination administration programs that resulted in the administration of more than 165,000 doses. These range from 8-bed group homes to large facilities from special education residential programs to homeless shelters to large congregate care facilities and everything in between. Overall, across these settings, 60% of staff have received at least one dose, and 70 to 80% of residents, depending on the congregate care type, have received also at least one dose. Additionally, many of the homeless service providers provided vaccines to individuals experiencing homelessness who won't come inside into a shelter and stay on the streets. With an average 5% weekly turnover at individual shelter sites, reaching all shelter residents is an ongoing effort, and we continue to coordinate with local and regional health providers to ensure that our ongoing vaccination access for shelter residents is needed. As we continue our vaccination distribution, I am hopeful. We've experienced some very dark days over the course of the past year, but amid all of the uncertainty, I have found that in Massachusetts, we never lost focus. We rolled up our sleeves and got to work. I'm extraordinarily grateful for the can-do spirit, the one-size-doesn't-fit-all approach that we have in our state. No one is forgotten, and strategies must and will continue to evolve based on the data, the experience, and the opportunities available. We would not be where we are today without the partnership of all of our providers, from councils on aging to healthcare providers to residential providers to mass vaccination providers, and to the millions of Massachusetts residents who have made the decision to protect themselves, to protect their loved ones, and their community. We're in this together, and together we can do this. Thank you. It's now my privilege to turn the podium over to Dr. Paul Bittinger, who serves on the Governor's Medical Advisory Board and who chaired our Vaccine Advisory Committee. Dr. Bittinger, and also has a day job.
So thank you, Governor, Lieutenant Governor, Secretary Sutters. It's a pleasure to be here, as always. I wanted to say a few words to those who may still be taking a wait-and-see approach about vaccination or who are still considering whether vaccination is right for them and still have questions. As we know, there are 3 vaccines, of course, in the United States that have received emergency use authorization from the FDA that followed research trials that involved tens of thousands of participants in each vaccine's trial. Since the emergency use authorizations were issued, nearly 150 million people in the United States have received at least one dose of a COVID-19 vaccine, which represents more than half the population over 16 years of age who are currently eligible. We are so fortunate that here in Massachusetts, approximately 70% of eligible individuals have received at least one dose, which is just such an extraordinary number. If people have received a first dose of Pfizer or Moderna and are due for their second dose, please get that second dose because it's your most effective and longest lasting protection against COVID. But if you've been waiting it out so far, I would like to say, as others before me have said so well, now is the time to schedule your appointment. We now have data from 150 million people who are getting vaccinated, which continues to prove the safety and efficacy of these vaccines. We have now multiple studies in the scientific literature that demonstrate in the real world that the safety and effectiveness of these vaccines is what we saw in the clinical research trials. And these vaccines are more than 90% effective in the real world settings altogether at preventing infection with COVID. And of course, preventing infection with COVID is important, but really, and I say this as a physician, preventing hospitalizations, preventing deaths is really the most important to reduce risks of critical illness. And just in the past couple of weeks, we have seen data that have showed that people over the age of 65 are 94% less likely to be hospitalized if they get vaccinated, if they are fully vaccinated. And in all age groups, we see data that shows that fully vaccinated individuals have a decreased risk of dying by more than 29 times what it would be if they were unvaccinated. In terms of safety, we continue to see data that was in those research trials, and the risk of a serious side effect after a COVID vaccine is approximately 0.005%, or 50 in a million. And by contrast, the rate of death from COVID-19 is 32 times higher than that risk of a serious adverse event, and the risk of hospitalization is 120 times higher. So what we're seeing in the real world is proof of the safety and effectiveness of these vaccines, as we have been saying, and as the data shows. I would like to add one last thing for folks who may be a little younger and may be hesitant because they are less concerned about the possibility of critical illness or death from COVID. And that's that we are increasingly understanding the importance of what we call long-haul COVID or extended symptoms after COVID infection. It appears, according to the NIH, that approximately 10% of individuals who get infected with COVID may have ongoing symptoms of respiratory, of cardiac, of neurologic illness that persist after their acute infection with COVID is over. And therefore, the best way to avoid these extended symptoms, no matter what age range you're in, is to get vaccinated against COVID. So if you've been waiting to see whether there was more data and more experience, we now have it, and there's really good news about what we know about these vaccines. It's so important for all of us to be vaccinated to keep us safe, to keep us out of the hospital, and the more of us that are vaccinated, the more protected as a Commonwealth we are, the less pressure there is for new variants of the virus to evolve, and the less likely we are to see changes in the rate of infection. So I would add my voice to those who've spoken already to encourage you to book a vaccine appointment if you have not already. I want to thank the Governor, Lieutenant Governor, Secretary. Thank you all.
Questions?
Governor, what do you make of this idea that herd immunity is not possible across the country? Obviously, in Massachusetts, there's tremendous vaccine uptake here, but we are part of the country. So with herd immunity not necessarily possible, I mean, should people really feel terribly comfortable heading toward June in that 4.1 million number?
I think the way that we're thinking about this question about herd immunity is the more people you get vaccinated, the safer everybody will be as individuals and as a community. But in addition to that, the take-up rates, as Dr. Bittinger spoke to, and I may have him answer this question as well, the take-up rates among the populations that are most vulnerable across the U.S. are very high. Now, they're higher here in Massachusetts, but they're very high everywhere. I mean, my recollection here is we're somewhere in the high 80s in terms of the over 75 population and the mid 80s among the over 65 population. And nationally, I think we're pretty close to 80% on both of those populations as well. High 70s, low 80s. So the community that we all worried about the most at the very start of all this, and continues to be the community that's most at risk across the country, has been pretty successfully vaccinated so far. That has huge consequences for both the hospitalization issues and the issues associated with mortality that Dr. Bittinger spoke to. And I think our goal is going to be to just make this possible for everybody who wants to get a shot, and to do all we can as we work through that 30% that hasn't been dosed at least once yet in Massachusetts, to try to create more accessible and easier and sort of closer to home sites to get it done for whatever reason that they might not have been vaccinated.
Can you tell us who this 30% is? Are these people who just don't want the vaccine at all? Are these people who just don't have time to sign up? Who exactly are you targeting?
Well, the data on the survey work that we've seen and that we've done basically says that the vast majority of the 30% that haven't been vaccinated yet aren't people who never want to be vaccinated. They just didn't want to go first. Still operates under an EUA. There's tremendous amount of real world experience at this point that they are safe, vaccines are safe, and they are effective. But in some cases, it's literally just us getting to them and making it easier for them to get vaccinated. That's why the mobile sites are going to be a bigger part of what we do going forward. It's why we're going to continue to invest in partnerships between hospitals and community health centers and local organizations to bring vaccines more closely to people who may not have access to transportation or some other mechanism to get vaccinated. And I think for us, the great news here is that given options and opportunities, a huge portion of the adult population in Massachusetts has already chosen to get vaccinated. And the goal for us now is to try to do some things to try to create a more local and regional opportunity. The percentage of the population that was just no in Massachusetts, remember, was way under 10%. So we still have a bunch of people we think we can reach. Do you want to take a run at this question about herd immunity? Yeah.
So often when we use the term herd immunity, it's about eradicating a disease in the community, like measles. When we talk about herd immunity, it's that there's not circulating measles. And I think there is an evolving thought about whether we can eradicate COVID in the community, the coronavirus, and probably not. But it's about managing the consequences so that even if there are low levels of COVID, all of those who are vulnerable, and most of us in general, are protected and not sharing the virus. And so as a consequence, people are very, very unlikely to need hospitalization, even less likely to die of the illness. And so, you know, there are other coronaviruses that cause basically common cold. The hope is to minimize those consequences, get this COVID, get this coronavirus down to be as close to an ordinary infection as opposed to the extraordinary one that we've gone through.
Doctor, is there any kind of a public health danger of closing down some of these mass vaccination sites that we've relied on so heavily, or are you totally on board this is the right move?
So I think the public health danger obviously has been so effectively addressed with COVID, and our job, or with, excuse me, the vaccines against COVID, and our whole job is to continue vaccination. And so I think the best thing to do is to just maximize how we're reaching those who are yet unvaccinated with targeted efforts.
Do you feel comfortable saying the worst of this is behind us here in Massachusetts?
I would love to be able to say that. I think we've seen incredible progress. The numbers have come down, overall case rates, positivity rates, numbers in the hospital, numbers in the ICU. So everything's pointed in the right direction. So we're really, really making great progress. I think the most important thing, again, to suppress variants, to make sure we stay healthy, is to finish the work that we've been doing so far.
Doctor, do folks who, for one reason or another, don't get vaccinated, do they put others who have been vaccinated at any sort of risk?
So we obviously want to have as few people who've been unvaccinated as possible in the community because they can transmit disease, and there are those for whom a vaccination may be less effective, such as the significantly immunocompromised. So we just want to vaccinate everyone we possibly can. We still, of course, have many of our distancing measures in place, indoor masks now, et cetera, and we'll continue to follow the science about what we know about how the disease is transmitted once we get even higher and higher levels of immunization.
Governor, could you answer about the second dose? You talked a little bit about how 99% of people come and get a second dose. What is the percentage? Anecdotally, it seems like you hear people are not going to get their second dose. What's happening, and what are you doing to make sure that people do go and get it?
So the real world experience in Massachusetts anyway is literally basically almost everybody who gets a first dose gets a second dose. I mean, we've had very little drop off from first dose to second dose here in the Commonwealth. Much higher percent of our population has showed up for a second dose than we've seen in the national data. I think there's a couple of reasons for that. One is almost all the operations, the hospital operations, the regional collaboratives, the mass vac sites, community health centers, almost all of the organizations that have been part of our world on this have operated under a model where we want them to schedule people's second doses before they leave when they get their first dose. And I think most people who've been vaccinated would tell you that during that 15-minute waiting period, there's someone hovering around you, or you're getting a text message on your phone or an email that says it's time for you to schedule your second dose. And we've had very little no-show on the second doses here in the Commonwealth. And I think we would expect that would continue to be the case. People seem to get the idea that for both Pfizer and Moderna, you really need to get both to be sort of fully vaxxed.
Why do you think this part of the country, New England, has about 5 states that are on the top? I mean, why do you think it is that people in this part of the country seem to think that the vaccination is important to get done?
I think, first of all, this part of the country took it pretty hard to begin with, and I think that left a lasting impression on a lot of folks. The second thing I would say, and this is, this is me tooting Massachusetts horn a little bit. we are by far the biggest state in New England, and we're the only state in New England that's part of the top 25 states that have at least 5 million people. Smaller states, generally speaking, in terms of population, have generally had more success than some of the larger states in getting to a bigger proportion of their population faster. But I think the region overall has been pretty focused on beating this virus back, and I think people buy into the idea that the best way to beat the virus back is to get vaccinated.
Governor, could you run down again which mass vaccination sites are closing, and was this a decision that these venues needed their space back, or was it, how did you make the decision which ones?
Well, first of all, remember, this is the end of June, right? During my remarks, I talked about the fact that these folks are still going to deliver a heck of a lot of vaccine over the course of the next 30 to 60 days. I mean, I'd look it up, but I'd probably get it wrong. I think it's somewhere in the vicinity of about 430,000 shots, first and second doses, are still assumed are going to occur at the mass vaccination sites over the course of the next 30 to 60 days. The 3 sites that are scheduled, and that doesn't include some of the stuff they'll do with groups and on walk-ins in some cases going forward, but the 3 that are going to close are going to be the Hines site, which, remember, is tied to a temporary relationship that we developed with FEMA. It was always assumed that at some point FEMA, was it 6, 8 weeks? It was 8 weeks to begin with. Do I need any more detail than that? Okay. And Gillette and Natick are the 3. And Danvers, sorry, and Danvers.
Okay. How did you make that decision? Which one?
I think it was basically driven by, A, the availability of alternatives, which makes a big difference in this regard, and B, the relative level of participation that we projected out as we went forward.
Governor, has the J&J vaccine been less of a game changer than you had hoped?
Yes, for a couple of reasons. The biggest reason the J&J vaccine has been less of a solution for a lot of people is it hasn't been available. I mean, if you go back to sort of when this was all beginning, I think the assumption we all had was that there would be a significant amount of J&J vaccine available reasonably early in the process, and that it would sit, as part of the mix along with Pfizer and Moderna. And what's basically played out is there just hasn't been that much. I mean, have we had 250,000 doses of J&J in Massachusetts?
No, we've administered about 210,000. We might have about 230,000 doses that we've administered. 210,000.
So think about that, 230,000 doses of J&J since the end of December, and we have 6.2 million shots that have been administered. I mean, it just hasn't been as big a part of the answer as Pfizer and Moderna, because there hasn't been that much of it around.
Governor, looking ahead to the future, the Lieutenant Governor spoke briefly about the potential for children ages 12 to 15 to be able to get the vaccine in the coming weeks, if that could see approval. Do you expect mobile clinics at schools for that sort of thing? How are you anticipating getting those out to students at that age?
I think we'll probably pursue the same process that we've pursued with the rest of this, which is we'll talk to a bunch of the experts, and based on the guidance and advice we get from them, make sure we have infrastructure in place that's going to work for that population. I think our goal at this point is to make sure that we have access to everybody who wants to get a vaccine, and in particular, our primary focus at this point is on a lot of those folks in disproportionately affected communities, and a lot of those folks who are part of the hesitancy community, for lack of a better word, and try and do more to make opportunities and options available for them. But with respect to the 12 to 16-year-olds, we'll spend some time talking to the experts and figure out what the best way to get them vaccinated will be.
Other states are doing these mobile clinics to schools. Is that something that you're considering, or is that something that?
Everything is always on the table, seriously. I mean, and if that's something that turns out to be an operative process, we'll certainly consider it. The thing to remember here is you're still talking 2 doses, Pfizer and Moderna. Still comes with all kinds of issues around storage and prep and all the rest, and we have a less than 1% lost vaccines at this point, and we're going to want to keep our percentage there.
Last question. We're seeing cities and towns and regional collaboratives to go on more walk-up-based appointments for vaccines. How large of a role do you see walk-up clinics playing in the state's efforts going forward now that mass vaccinations are going to be taken out?
Do you want to take a crack at that? I think the answer is they'll definitely have a role to play.
Is it time to move away from appointments?
I'm sorry, what was the end of that?
Is it time to move away from the appointment-based model?
Yeah, definitely walk-in clinics have a role to take any barriers off. What we have to do is make sure you have enough staff at the front end in order to register you as you come in. And so that's some of the changes that we're making this week, and you'll hear more about that, yeah.
Secretary Sutters, would you agree that we're through the easy ones and now we're getting...
There's been nothing easy.
Well, we've been clamoring for people were websites crashing crazy. Now there's like a lot of spots and there's people, my own daughter's like, I don't know.
Well, you should talk to her.
I know. I listen to government paper every day. So how do we get to these people? It's going to be public relations campaign in addition to just driving places to get people. Right?
So I think we feel good about where we are at this moment, the fact that 70% of people over the age of 18 have gotten 1 dose, and we're well on track to the 4.1 million people by the end of this month, early June. I think this next iteration, the reason we keep evolving the vaccine program is in response to how do we continue to reach the 30% of the folks who've not gotten vaccinated. So the walk-ins, for example, changing hours, many more pop-ups, the mobile clinics in places, expanding primary care sites. So, you may not be comfortable going to a mass vac site, but if you got a call from your doctor, you might go get your shot. So what we're trying to do now is to just continue to evolve the vaccine administration program out to community, out to particular populations. And honestly, all of us have, I think, an obligation to really talk about the efficacy of these vaccines, the safety it means that we can return to our new normal. So I think all of us have a role to play, and you'll see some more around public awareness and the like.
Thanks, everyone.
Governor, any new thoughts on different kinds of mandates? We talked about state employees last week. If the effort is to get as many people vaccinated as possible, you have it in your power to force a certain number of the population to do so. Why not?
I think we think this should be driven by incentive-based approaches. Make it easier to get vaccinated, easier to get an appointment, easier to find a location that works for you. The focus here really ought to be on creating positive incentives to get people get vaccinated. The idea that I would kick somebody out of a job, and especially in a kind of economy we have now, because quote unquote they wouldn't get vaccinated right away on an EUA-approved vaccine. No, I'm not going to play that game. I think what we ought to be doing is making it easier for people and creating positive opportunities for people to get vaccinated, and make clear to people that this is safe, it is effective with advisors and trusted voices. I mean, the clinics that are running in a lot of these community-based settings are doing very well. And they're doing very well because many of them are being operated either in or by or with folks who are really trusted voices in those communities. And we've talked before about the fact that there are a bunch of people who are hesitant about this who have very good reasons for being hesitant about this. And the idea that we would take those folks and basically make them choose between their rent and their food on the table and all the rest, when they have, in some cases, very legitimate reasons to be nervous about a government-run program that's going to put a shot in their arm. No, I'm not going there. I'm not going there. Thanks, everybody.
What about students, though? It is open to 12 to 16-year-olds. Would it be required to go back to school if it's available?
Could be. But that's not something we've talked to. And remember here, I think there are clinical trials going on for less than 12, aren't there? Yeah. So this could end up becoming part of the conversation around kids generally as we head toward the fall.
Thank you.
But it won't be as serious as what we've been dealing with under any circumstance, right? Just from a public health point of view. Correct.